let me ask each of our panelists, starting with Marjorie, please, what takeaway you would like policymakers to have from our discussion?
Well, first and foremost, we have two basic human variables we've discussed here today for the past hour. We all have them without fail, sex and gender. And so we need to incorporate them into all of our scientific platforms. We need to ensure that we analyze the data, and we need to then apply that across the clinical and healthcare delivery system to ensure that we are achieving personalized medicine. And I would just say that our FDA is very committed to this. Our Office of Women's Health is committed to advocating and educating and innovating across the agency and externally with our many stakeholders. And really the bottom line is, absence of evidence is not evidence of absence. And if science doesn't have the data, we can't find the answer. Thank you.
Thank you. Jill.
Well, first of all, thank you. This has been a wonderful panel, and I feel honored to be part of it. I would say I'm going to take off from what Dr. Jenkins said and really move into translation, a little more into translation, that we need to incorporate our understanding of sex differences. We actually have a lot of information right now that we could translate into clinical therapeutics, into thinking about healthcare systems differently in how we deliver it, so the impact of gender as well as sex in the therapeutics, and also towards policy and education of both the next generation in medicine and also the public, because the public plays a really important role in both publicizing the importance and demanding from your physicians as well and your healthcare providers to learn about these things, but training the next generation and also public awareness. And as I said before, I think I'd just like to leave you with the fact that there is all this talk about precision medicine and personalized medicine. We need to incorporate the impact of sex, because as I said before, what could be more personal or individualized than one sex? Thank you.
Anna.
Thank you. The global health community needs to do much more to improve women's health. Disaggregating data by sex is essential. We talked a lot about that. It's also important to have that data disaggregated in vital statistics and in clinical records that not always is available. But we need to focus on women's health along the life course. But we also need to pay more attention to women as healthcare providers. British offered a wonderful example of how important it was to involve nurses in your efforts in Nashville. And women, well, 99% of nurses are women, and women also take care of their families and their relatives, and they are the first contact with the healthcare system at the domestic level. But that kind of role is often invisible, very much not recognized, obviously not remunerated. So we need to work on both sides of the equation, women as bearers of health issues and women as healthcare providers. And that will have a synergistic effect on women's health and status.
Great. British.
Sure, thank you. So thank you for hosting this event. A couple of things, three things. One is that we need more specific sex-specific research, but more importantly, we cannot forget this disease is 80% manageable or preventable. So we've got to continue to go upstream. The second thing is, being an education and awareness initiative, we want to create a national movement, and we ask people to join us. It's going to require every sector. Federal government, state government, local government, a holistic health systems approach, but we need to create a national movement like what we've seen with HIV and AIDS, although it's an infectious disease, and also with breast cancer. There's a lot to be learned from both of those campaigns. And my last point is on the translational research issue. Translational research is critical if we want to see cures live in our communities, and we want to see better health outcomes, and we want to save more lives. So important that we translate our cures and translate our efforts.